Yes. Hi, everyone. I am Anna Frelsen. I am the CEO of Maternity Foundation. Thank you for joining this meeting, and thank you to the Paris Peace Forum for inviting us. It's a pleasure to be here. I'm here today to share with you some of our experiences from developing and scaling Safe Delivery, which is a program for midwives in terms of building their skills and capacity everywhere. Could we go to the, I'm just going to go in here and open the slideshow for you guys. Oh. Sorry. Okay, so here. There you go. I think we're getting there. This is not. Sorry, guys. Hopefully the slide will be here in a second. It's coming up now. There you go. So I'll ask maybe for a comment from our joint technical person to ask if the slides are showing okay on the screen for everyone. And at the same time, I'll start my presentation. Good. I hope the slides are showing okay. It's a little tricky to navigate in here. Good. So again, thank you so much for joining. My name is Anna again. I'm from Maternity Foundation. We are a I'm
trying to see from this end too, and it just gave me an error message.
Yeah, it's an error. Yeah, an error message came here also.
Yeah, it just says it's kind of. It looks like from my end.
It's the same here. Yeah, and then here's so small.
Oh, maybe is it because you freeze for 30 seconds? Is that why?
It's a message.
Should I type to her again? Right under his.
It's not. Yeah.
Yeah.
You should put the presentation, but it's.
Maybe stop sharing your screen. So you turned off your screen share.
No, I should turn it off. Or?
Yeah, she said just like don't share your screen.
Okay.
Can I ask her if you should start presenting?
All right, let's start again. I would like to have some help to get the slides up so everyone could see them. But otherwise, I will also just, yes, please. So maybe so the slides are at the center, that would be fantastic. Sorry about that. I guess this comes also as a part of our new world with all virtual. Anyways, thank you so much for your attention. I will start talking a little bit about Maternity Foundation and why. Yeah, just see if I can see the slides. And who we are. So we are a tech and training nonprofit working on building maternal and newborn health with a special focus on leveraging technology to reaching the most remote and low resource settings. And why is this important? Well, there has been progress in terms of maternal and newborn health the past many years, but still we have quite a gap to reach the targets for 2030, which is to end all preventable maternal and newborn deaths. Still today, on a daily basis, 800 women and 7,000 newborns will die due to causes related to childbirth. And the far majority of these deaths are actually preventable with some fairly simple interventions from a skilled birth attendant. So this is not a matter of investing hugely in equipment or hospitals and so forth. It's first and foremost a matter of making sure that women give birth with a skilled birth attendant by their side. But there is a gap to reach the targets towards 2030 of 9 million additional midwives and nurses. So that's a gap in number of health workers. And at the same time, in terms of quality, there's also a huge need in terms of training and supporting midwives with essential basic skills and knowledge. And that is what we focus on at Maternity Foundation, to build that basic skills and knowledge among midwives and nurses, even in the most low resource and remote settings. And that's why, together with the University of Copenhagen and University of Southern Denmark, that we have developed the Safe Delivery app, which is a simple tool that based on animated instructions from WHO guidelines can support the midwife in terms of how to handle these critical life-saving interventions. We know that if the midwife knows how to stop a bleeding after birth, if she knows how to resuscitate a newborn that isn't bleeding after birth, if she knows many of these really simple skill-based interventions, then most lives can be saved. And that is what we are seeking to address with the Safe Delivery app. The Safe Delivery app functions both as a job aid, so it has step-by-step instructions in terms of how to handle critical interventions. It has lookup lists and so forth. And then it's also a training tool, so it can also function as a way to instruct in breaks or in the training room and in school. It can support and instruct the midwife and other nurses and in terms of reaching critical curricula and training targets. The app is both used as a job aid and as a training tool in urban settings and also in the most remote settings, and is used both in humanitarian settings and in more stable context. The agenda that we are tapping into with this tool is its training of midwives, and is in terms of addressing the gap that I mentioned before in terms of building the capacity of many more midwives across the world. And in general, when we talk about training, we see a shift in training from the more theoretical lecture-based training where health workers and health staff from remote settings are asked to come in to training rooms and have theoretical lectures, to a more hands-on skill type of training that happens more over time and in lower doses. And here, the concept of digital training combined with in-person training fits very well. Which is also called blended learning. But that blended learning is not about having in-person training and digital learning. It's about the way that you combine the two. And here, what's shown on the photo is an example from how we have done that in Ethiopia, where we have the drills, the skill-based training combined with My Learning on the app, which is a personalized adaptive learning taking each health worker through different levels of learning, and then in the end they can pass a small little certification test. So this is just to give a brief background of what the objectives behind the Safe Delivery app and how it functions. But one thing is to put a lot of great content into an app, but does it work? Can you use an app to build critical skills in the most low resource setting? Can you support a midwife who's working alone in the outskirts of Ethiopia or somewhere else, and thereby through an app support him or her by building critical skills, confidence, and knowledge? And in order to test that, we had a randomized control back in 2014, and over a 12-month period, we tested, the development in midwives' ability to handle critical interventions, such as how to stop a bleeding and how to resuscitate the newborn. And what we saw was that health workers more than doubled their capacity. And this that we also saw was that in the intervention group, it was a continuous learning curve. So it was not, as you normally would expect learning, that it increases fairly quickly, but then decreases again. This was an ongoing increase in both knowledge, confidence, and skills. So this was very encouraging for us in terms of launching in 2015 the Safe Delivery app, and thereby making it freely available for partners, for midwives globally. And since then, we have really worked on figuring out what is the best way of really reaching those midwives who are working out there in sub-Saharan Africa and Asia and so forth. So far, we have reached more than 165,000. We have a fairly high engagement among our users, which is 46%. And thinking this is not Facebook, this is a medical training and support tool. This is actually a fairly good share of engagement. And we're then working now with partners to really figure out how we can best support them and support ultimately with the midwife. This is really, our effort is really to bridge the gap for midwifery learning, and doing that with partners, doing it with global partners who have already a strong reach and strong programs out there, and doing it with national partners, both in terms of adapting the app to different contexts in terms of language, visuals, and context, but also in terms of really integrated into national programs in terms of training, education, and so forth. So for example, in India, we have integrating the app with a national capacity building effort called Lakshya, and thereby having it rolled out to most states and to as many midwives as possible. So this is just briefly about the Safe Delivery app and the reach we've seen so far. Having a digital solution that reaches midwives has proven to be important, especially in 2020, because here we have not seen less but more barriers than normally. Because now more than ever, the outreach is really hindered by the pandemic. At the same time, as we have a pandemic, we cannot postpone the childbirth. It continues to be an essential service that needs to be provided for women and newborns. But at the same time, there's a huge shift in staff, in resources towards dealing with the pandemic, of course, which makes the everyday life for the midwife even more challenging. At the same time, what we have seen here with the pandemic is that women have increasingly not seek the care they needed at the facility. They have stayed away because of the risk of contamination. And as a consequence of these things, as a consequence of less prioritization, less resources, and less women seeking the care, there's a risk that we are looking into a scenario where up to 100,000 additional women will die due to childbirth, and an additional 1.8 million children under 5 will also die on an annual basis. And we have to do everything we can so that this scenario does not become a reality. At the same time, with the pandemic, there has also come a lot of myth in terms of what is needed and how do we as midwives and as health workers in general deal with the pandemic, and how do we deal with a woman who's been contaminated, what are the procedures we should handle, can she breastfeed, and so forth. So there has been a huge need in terms of really, as quickly as possible, share the best practice and the evidence that as it has come out in terms of how to deal with the pandemic. And here there wasn't really a good opportunity building on the Safe Delivery platform and our reach to quickly build essential content that could then go the last mile and support midwives who otherwise would not know what to do in terms of dealing with the pandemic. And together with UNFPA, the International Confederation of Midwives, Leerdale Global Health, and other partners, we already back in March, we started to develop content about how to handle the pandemic. And rolled it out. First, we tested it in Tanzania in April, and then soon thereafter, already late April, we were able to launch both on our global master versions of the app, but also with 9 countries. Soon thereafter, we were able to launch this critical content. And since then, as new evidence have come out, we've been able to ongoingly update it. But in addition to that, as I mentioned earlier, the way that we have developed the app is not only as a job aid, but also as a blended learning training tool. But now we don't have, to the same extent, physical trainings, again, because of the pandemic. So now we have really started to think about how we could have remote trainings along with the app. So we also have the skill part, the skill component of the training through virtual and remote trainings. Again, we've done this with partners, and we have so far, we have reached 40,000 with our remote trainings combined with the Safe Delivery app, and then enabled midwives to be certified in the COVID-19 instructions related to these trainings and the app. So I think you can say, and I think we can all recognize also just by sitting in this meeting today, how all the different media, all the different ways that we can still, make our work valuable through an accelerated use of digital has really been, in the focus over the past 6 to 8 months. But when we work with digital, of course, we get a lot of data. We can quickly see, the effect of our effort in terms of reach, in terms of engagement, in terms of certified users, and so forth, which is important and encouraging. But even more encouraging is, especially now these days when we're not able to have the direct dialogue and contact with our users, to get direct feedback. And last weekend we had a remote training with a number of midwives in Papua New Guinea. And on the Monday after, our midwife trainer got a personal letter from one of the midwives sharing how he, after the training, had been able to conduct a life-saving intervention, and thereby potentially being able to save a mother's life by using what he had learned in the training. And that, to be honest, is really what keeps our day-to-day work going, even though we are not able to meet with our target group. So that was a little bit about our work, about how we have tackled the pandemic with strong partners, through strong partners, and last but not least, with midwives. So where are we going from here? We said last year, during the ICDP in Nairobi, we set a target of reaching 250,000 health workers by end of next year. So that, you can say, is our more quantitative target. But at the same time, we really want to continuously engage and support each midwife that we reach in the most meaningful way, so that we can create adaptive and personalized lifelong learning for each midwife that we are reaching. So that's really what we're focusing on now, building on the platform we have, leveraging new technology, leveraging knowledge about how we all learn. How can we then, over the journey of a midwife, continuously support her with meaningful content, learning, and so forth. All in all, this is, our focus is, in the context of the Paris Peace Forum, is quite specific. It's around midwives, it's around the mothers, it's around the newborns. But it's also about what we can learn and sharing that in terms of scaling up a digital solution in low and middle income countries. And here I have a few learnings that I would like to end this little presentation by sharing with you. And it's 5 learnings. The first one is, even though our core focus is around scaling a technology, success is really not about technology. Because putting a great app out on Google Play or on App Store will not make a difference. And there are, to be honest, thousands of medical apps out there that doesn't get used. So it's really the critical part come really after that where you have the technology done and how you get it out and have an impact in the everyday life of the midwife. And I think there is a risk that we can all really get carried away in terms of what technology can do in terms of AI, virtual reality, and so forth, which is potentially very important. But I think it's really, the main thing is about having the simple, focused innovation that can bridge a gap in the everyday life of a midwife. And that brings me to the second learning, which is the digital tool, especially today, has a great potential in filling the gap in learning, in supplementing trainings, supporting individual learning styles, and definitely also ensuring the retention of learning. But it has to be integrated in a pedagogical and meaningful way for each country, each partner, and each midwife. Thirdly, we have to think about beyond pilots, because one thing is to get strong evidence, as we did back in 2014, so that we all know that the solution works. And this is the first essential step in order building credibility and attracting partners and so forth. But the hard work comes afterward. How do you go from the pilot state, the pilot cities, to the real scale? And this is really the ongoing, not always so linear journey, where you have to make make collaboration your DNA, and really think about how you best support and work through partners, how you best become interoperable with other systems, platforms, and so forth. The next learning is really about that you have you really need to have the user in the center. You need to design with her needs in the center, but at the same time also work through strong partners. And here, the ownership of obviously is not from the ones who have the solution, but from the ones who are implementing it on the ground. And here it's critical that there is adaptability in terms of how the solution is integrated, in terms of what languages are used, in terms of the visuals and the clinical content used. At the same time, though, building a strong, validated, and scalable backend in terms of what we have done with our safe delivery platform is really a huge investment. And in order to make that cost effective and to really harvest those synergies that come from across different countries in terms of addressing the different needs, these type of solutions also really need to be scaled on a standardized backbone. So that's why we say that it has to be 80% standard, but then 20% adaptation, but something that comes close to 100% in terms of the ownership of the countries implementing. Those were, an effort to really share some of our learnings. And I can see now we have both time for questions, but also I think there are some questions here that I would like to now look into and then see how I can best answer. So the first question here is, do you intervene in collaboration with the authorities at the request of the authorities? Yes. So when we launch a country version of the Safe Delivery app, it is in collaboration with and with the stamp of ideally the Ministry of Health in that given country. So they will review the content, they will approve the launch of the the version in the country, and then they will also support us and guide us in terms of how to best integrate the app into the programs in the given country. The second question now is, how do you deal with connectivity? Yes, that's a very good question. So connectivity, when you go to the front line, is still, they have the smartphone often, but there is a challenge of connectivity. Therefore, the app it works offline. So as soon as you have it on your phone, it works offline, and it can be transferred from phone to phone via Bluetooth. So that we have very good feedback that is a very good way of tackling that part. But of course, when we're now with the COVID, we're working with remote trainings. That's more tricky because they're having a virtual training. You do have to have some connectivity, obviously. And here we have worked on different modes of where you can actually download the content of a training and then have it at the time where there's, also where there's space for it, but also where you not necessarily are dependent on internet, like directly. Do you see this tool being useful in disseminating a COVID-19 vaccine in conflict area? I think that's a very good question. Of course, our target group is midwives, but I think already with the COVID-19, we have really said, we also can use this platform with broader knowledge, such as, how to apply PPE equipment, protective, in terms of gloves and everything. So I think it's not something we have strategically, considered or haven't had a concrete dialogue with partners around. I think that's a very interesting opportunity, and of course we need to all, do what we can to chip in and address this conflict that we're all addressing. And that's the same question again. Do you see this tool being useful to disseminate? What are the cultural considerations you incorporate in the medical attention in the conflict zones? Yes. So when we introduce, we have the Safe Delivery app has global master versions that are based on WHO guidelines. So they are universal guidelines. Then every time we launch a national version of the app in a given setting, we will always work with the authorities in terms of adapting it to the local context. Currently, we are actually working with UNFPA for launching an Arabic version, and here we're also discussing very much what are some of the essential things. How do we make sure that we address not only the contextual visuals, the languages, but also have the appropriate clinical guidelines for example, conflict zones. So that's a review process that's ongoing, but where we definitely will consider these questions thoroughly. We have seen during the Ebola response in DRC that humanitarian and health workers have been targeted by armed groups and communities. How can we make sure that our staff in the field are safe when implementing a COVID-19 vaccine in conflict zones? That's a very big and difficult question that, of course, reflects the terrible reality that many midwives and health workers are facing. With our app, it's unfortunately not something that we, of course, can address, but we can more focus on creating the best safe environment around the midwife in terms of the clinical interventions that she is performing. But thank you so much for that question. I'm just trying to see if there are any additional questions. It says I have 5 minutes left. I think there's another question here where I would say we haven't been able to do that, but were you able to identify any patterns in how armed groups have used the COVID-19 pandemic to advance their objectives? No, again, our focus is very much on the clinical interventions and again, yeah, not so much the surroundings. I don't think there's any more questions. If there's one coming up here the last minute, that would be fantastic. But otherwise, I will let our technical advisor, give me any other questions if there are one. Otherwise, we can stop here, and I would say thank you so much for your attention. Do you work with midwifery associations? Yes, absolutely. I think there's only one way that we can build the skills of midwifery, that is by working through midwifery associations, and we do that fortunately in many countries, not only in terms of disseminating the app as such, but also in terms of integrating the app with a strong curriculum. How do you create new content? Now it keeps coming. We do that again with partners. We do it based on needs, needs from the users around the safe delivery app, which is of course our key focus. And then we base it on once new evidence come out, we update existing content, but also, for example, currently we're looking into how we could add family planning, because we see a huge unmet need also in terms of providing family planning services before and also actually after other maternal and newborn services. Thank you so much. I think time has run out. Have a good forum.